My name is Emmy Owen, and I played Linda Jenner.
My name is Caroline, and I'm playing Edward, also known as Big Ed.
My name is David, and I'm playing Tiffany, registered nurse.
Darling, I know these last couple of days have been so hard for you, but things are going to get better, and I am here for you. It is you and me, the two of us.
What did I do to deserve you, sweet thing?
Hello.
Something so sweet.
Hey, Miss Jenner.
Hello.
Sweetie, where are my glasses?
They're on the top of your head, darling, just as always.
Okay.
Miss Jenner. Hey, how are you doing?
I'm doing okay. I'm doing much better than I was.
I'm your nurse today. I just wanted to check in on you. How are you doing? How are you feeling?
Oh, I'm feeling much better. I feel like I can actually breathe again. So
Excellent.
very thankful for that.
I have some good news for you. The doctors were talking, and they're saying they're going to discharge you today, okay?
Oh, how exciting.
Thank
That is
goodness,
so
praise
exciting.
the Lord. I have just been dying to get back to my garden and my book, and I need to finish reading and writing and doing
She
so many
has been
things,
very
so.
busy lately, so we gotta get her home, okay?
Well, I'd like to take a minute, if you don't mind, and go through your discharge instructions.
Oh, yes, take a seat, sweetie. Of course, of course.
Oh, yeah.
My, what fine headband you have
So
on.
we have some follow-up appointments scheduled for you, okay? We went ahead and we scheduled an appointment with your cardiologist and with your psychiatrist. And then when you get home within about a week, you're going to have to schedule an appointment with your primary care doctor and with the dietitian, okay?
Huh? We can do that.
I'll
absolutely.
put it in my BlackBerry and I will help you remember, okay?
Thank you,
I got you.
sweetie.
I'll keep you on schedule.
Thank you, Chef.
Is there anything else?
Well, do you have any issues with transportation at all?
Well, I got that big old Toyota in the back, and I just recently bought her that Nissan Altima.
Okay.
So,
Would you be able to drive her for the first week, do you think?
oh,
Two?
of course.
Sweet Ed here takes such good care of me.
I don't think I have a lot going on. I can call out of work. I don't care. She is my wife, and I will take care of her as I need
Some
to.
changes to your medicine, okay?
Okay.
So you're gonna be taking Quetro for your bipolar disorder.
Okay.
You're gonna be taking Jardiance for your heart failure.
Okay.
You're gonna be taking Coreg for your heart failure and for your blood pressure.
Okay.
And you're also gonna be taking Entresto for your heart failure, okay?
That's a lot of meds.
That sure
Goodness me.
sounds like a lot of meds.
And then you're gonna stop taking your low pressor, right?
Okay.
Your metoprolol, you're gonna stop that. Your Wellbutrin, you're gonna stop taking that, and your Hyzar, you're gonna stop taking that.
Okay.
Okay, so you're gonna have to go to Walgreens and pick up these 4 medicines.
Are
okay?
they already there at the Walgreens for us right now?
I think the doctor already put it in.
Fabulous. All
It
right.
tells you exactly when you need to take all these medicines.
Great.
I suggest maybe doing a pill organizer or something like that.
You know, I'll tell you what, how about we go ahead and put that on the fridge? So every morning when you're making me some breakfast, you can just check and you know what med to take and when.
It's going to be so important that you keep taking your medicine even if you're feeling better, okay?
Oh yeah, I mean with that handy schedule you made us, I'll take them
I
every morning.
always said
Absolutely,
if
every
you're
day.
feeling better, the meds are working, so you gotta keep taking them, huh? That's what
Exactly
I
right.
Even if I feel better.
If you start feeling better and you stop taking your meds because of that, you could just end up right back here. Okay? Information about the new medicines that you're going to be taking, okay?
Okay.
There's a lot of possible side effects here. It's going to be good to know these things. The main thing you're going to have to consider with these medicines is that it can definitely make you dizzy when you stand up, and that's kind of expected. So what I would suggest doing is changing positions very slowly and maybe dangling your feet over the bed for about a minute before you get up and get moving. Is with the Entresto, because of this other drug that you were taking before. So you're not going to take your first pill of Entresto actually for 48 hours. So wait 2 days before taking this.
And again, I got that BlackBerry, sweetheart. I'm gonna put that in there.
Okay.
I'll set a timer. 48 hours.
Some reading material about heart failure, and I just wanted to hit some key points. We've got a section here about red flags that your heart failure is getting worse, like swelling or needing to use more pillows, so definitely read that. And then we've got a section here about the zones of heart. Basically tells you kind of how bad your symptoms are. In the green zone, everything's all good, you're under control.
Green means go.
Green means go. In the yellow zone, your symptoms are a little concerning, you should talk to the doctor about it. And in the red zone, that is where it's out of control and you need to seek medical attention, okay? So that would be your danger zone.
Absolutely. Okay.
I'm gonna make sure we ain't gonna get to that green zone.
That red zone.
That red zone. Excuse
There you
me.
go, there you go.
My memory is starting to slip.
I
Okay.
wanted to make sure that I was clear when I was telling you about it. Can you tell me a little bit about the 3 zones?
Yeah. So the green zone is good. We're doing good.
Green
I
means go.
I mean, do my gardening and such, and then the yellow zone is a little bit more cautious. I'll call if I have some questions
Yeah.
or we're getting a little bit bad.
Call your doctor.
And then red means not good. So we
It
need
means
to.
you need to stop.
Yeah, you need to call 911 on that.
Uh-huh.
but-
You get home is you're actually going to be taking your weight every morning.
Why?
So
Do you think I'm fat?
Oh, honey, you ain't fat. You are slim thick.
it actually has nothing to do with your weight. It's got nothing to do with food. It's actually about fluid, okay?
Okay.
So-
Fluid, not food.
So
okay.
heart failure, your heart can't get rid of fluid the same way, okay? And
Okay.
taking your weight every morning is the best way to keep track of how much fluid you have stuck on your body, okay?
Oh, that makes perfect sense, honestly.
So you're going to be keeping a journal, and you're going to be weighing yourself in the morning every day. Okay? You're going to
Okay.
use the same scale.
Same
We got a
scale.
scale.
You're going to be doing in the morning after you go to the bathroom,
We got a toilet.
Okay.
before you eat anything,
Okay.
and you need to wear the same clothes.
Same
So if
clothes,
you
okay.
if you're naked, stay naked. If you're wearing pajamas, stay wearing pajamas. Gain 2 pounds or more in 24 hours. That's a sign that you're holding on to too much fluid and that your heart failure is getting worse.
Okay,
So
okay.
you should call your doctor if you gain 2 or more pounds in 24 hours.
Honey, I know you don't like taking your weight because you just don't want to know, but this is important.
I know,
Okay,
I
so
know.
I just want to make sure I'm clear about this because it's so important. Can you explain to me how you would take your weight in the morning and what you would do?
Yeah, sure thing. Okay, it was 4 things, I'm pretty sure. All right, the same scale in the morning before or after I pee, in the morning after I pee, before I eat anything, and in the same clothes.
or naked, honey. You can do it however you like.
And I need to monitor my weight and make sure I don't gain, what was it, 2 pounds?
2 pounds,
So
2
2
pounds.
pounds in 24 hours.
That's right.
Yep.
Exactly right. These are diet instructions, okay?
Oh, good.
Your doctor is putting you on a special diet where you actually can only eat up to 2 grams of salt.
Okay. Salt. Okay.
2 grams of salt every day and only 2 liters of fluid every day. Okay?
Okay.
That's
Okay.
that's the same size as a big bottle of soda at the grocery store. Limiting salty foods, fast food, fried food, popcorn,
Whoa.
canned foods.
No more KFC. If I
do
have to
too,
give up
darling.
KFC, I'll do it for you.
Look, and if you're doing it, we're gonna do it together.
Thank you.
And what are the kids eating? Kale? They're
Yeah.
having their avocado toast?
Yeah,
we're
nice.
gonna be eating that.
We can
we're
be
gonna
like
be
them
eating
young
that.
kids.
We're gonna
Absolutely.
be young again. Come on.
Turn to activity, okay?
Okay.
So we want you to be active, and we want you to get 30 minutes of exercise a day. But with your heart failure, you're also going to have to pace yourself, okay?
Okay.
If you are being active and you start noticing shortness of breath, chest pain, any kind of symptoms, excessive fatigue, that could be a sign that you need to slow down.
Okay.
You really need to incorporate rest, okay?
Okay, I
So-
can do that. As long as I can still garden, that's perfect
You can
with me.
you can garden, but I don't think the 10-hour marathon sessions are going to be happening. It's not going to be a good idea for your heart.
Can she go fishing with me? Does that count as an activity? Because I've been trying to get her to go fishing with me for years, and she just won't.
Sweetie, that would be so fun.
Do you think so?
I would love to
Is
do
that an
that.
activity?
Are you a big fisherman?
Oh well.
Are you kidding me?
Are you joking? I'm top fisherman in the country
You
right
caught
now.
that fish
I
in the
caught that
2020
fish.
classic.
I sure did, and I have my lovely wife sew it right on top of this cap.
I think that would be a wonderful thing to try. Tell me what you know about bipolar disorder.
Well, I know that I have it. It makes me go really, really crazy, and it also makes me really, really sad.
It
sometimes.
does. It does. It breaks my
Like
heart.
last year.
This time it may have just been a mix-up with the medication she was on. And maybe it just wasn't working this time. But she ain't no guinea pig.
Okay.
Hopefully, that new medication you guys put me on will help me kind of stabilize.
I hope so. Yeah, you're definitely right that bipolar has those periods of depression, those low feelings, and then mania way up here. But what might be new to you is that when you are having an episode of bipolar disorder, you're having those extreme moods, it's actually going to be really dangerous for your heart failure, okay? Because it's going to be very hard to stick to your routines and your medication. Pay really close attention to these changes in moods. You're going to have to learn your early warning signs, and you're going to have to, talk to your psychiatrist or your doctor, or seek some sort of attention if you're, going into one of these mood changes.
Okay.
And this is something that your husband can absolutely help with.
Yeah.
Absolutely.
You're going to be a big helper here.
Absolutely.
Okay.
I'll make sure she stays on her meds, but honey, you need to make sure that if you're feeling kind of funny, you need to let me know.
On the last page here, I just have some situations where you might want to be calling your doctor, okay?
Okay.
This includes a lot of the things we've already talked about, the increase in weight, changes in mood, heart rate above 100 or below 60. Do you take your heart rate and your blood pressure at home?
How are we supposed to know if her heart rate goes up?
Okay. Well,
Do I just feel it?
No, there's a way to measure it, and I'll show you how, okay?
Oh, okay. That would be great, Tiffany. Thank you.
And then here we also have some situations where you should just call 911 immediately. Your sudden severe chest pain, your chest pain that's not relieved by rest or nitroglycerin.
Oh, okay. Okay.
You have your shortness of breath here, hallucinations or delusions, and a cough with pink frothy sputum. That's actually nothing to do with a cold or anything. That can be a sign of really bad heart failure. I tell this to everybody, but if you ever have thoughts of hurting yourself or wanting to kill yourself or hurt other people, there are absolutely resources available, phone numbers available. These are available 24/7, judgment-free. Please be aware of those, okay?
That is so good to know.
Take such good care of me.
So I'm going to send this home with you two. I want you to keep it safe and read through it, okay?
Absolutely. We'll put a couple of those on our fridges.
Yep.
I'm going to go get a blood pressure cuff, and we call it a pulse oximeter. It's
Okay.
just a little clip, and I'll show you how to take your blood pressure and heart rate. Okay?
That would be so great. Thank you for sharing.
I'm back.
Oh,
I'm
goodness.
sorry. It just
Goodness
got
me.
really
You've got
busy.
a lot of things
It
for
just,
you right
it
now.
just got really busy.
Here,
all of a
let me
sudden.
help you. Let me
you
hold this
alright?
for you.
Okay. All right. So I'm gonna teach you how to take your blood pressure. Okay.
Can I drink some of this?
No, we're not drinking anything, honey. You are on a fluid restriction. You're already forgetting.
2 liters a day.
Yes, ma'am.
That's right.
So this is a
What is
blood
this?
pressure cuff.
Okay.
We've been putting that on you all day, but it goes over your upper arm like this, and then you just fasten it like that. Okay.
Okay. That makes sense.
And
Absolutely.
then you press the button. Can you show me how you do that?
Oh, yeah.
It's a little tricky to do it on yourself.
Just like that.
Well, you want to get it a little tighter.
Oh,
Okay.
perfect. Okay, nice and tight so it's around my arm.
It takes some practice, but your
Right,
husband.
we'll practice that.
Your husband might
Yes,
do
I
it.
was paying attention the whole time. I swear, honey. We know, and you know what? I think they got that dial-up internet on my BlackBerry. We can look it up if we need to.
Absolutely.
Yeah.
Absolutely.
So your heart rate, it's going to be this little clip right here.
Oh, perfect.
Okay, and we're sending you home with this one too. See how it's portable? And you just put it over your finger like that, okay?
And it tells me right there what my
Yeah.
my heart rate is.
You have to turn it on. There's a button right there.
Oh, I did. Okay. Turn it on.
See, now you see the numbers. You have to wait for a second.
Oh, okay.
Wait for a second and just keep your hand still. And now you
Okay.
see it's got 2 numbers right there.
Oh yeah, look at that.
So this number is actually your oxygen.
Oh,
Okay.
okay.
And this number right here is your heart rate.
Okay, perfect.
All
Good.
right.
Easy.
It's simple enough.
There you go.
Sweet.
This was so nice, by the way. I had a little sip of that.
Thank you.
All right.
All right. Well, good luck with everything, okay?
Well, thank you so much.
Absolutely.
Thank you
Tiffany,
so
you've
much.
been great. We appreciate you greatly.
Of
Thank you
course.
so much for all your
Yes.
help.
Thank
You've
you.
been great.
Thank you.
Of course.
Got a
Of
weak
course.
handshake. You got a weak
course.
handshake.
See you later. Press that button right there, okay? And this isn't what you're going to be sent home with, but you will get an electronic one sent home with you. Okay, I just talked to them.
250 over 170. Is that right?
No, we can do that. We're not doing that.